Hello, I'm Dr. Michael Shuler with Athens Orthopedic Clinic. Today we're going to cover ganglion cysts. Ganglion cysts are typically bumps that can occur on the back side of the wrist or on the volar side of the wrist, palmar side of the wrist. They're also referred to as Bible bumps. They're typically associated in younger, but they can also be seen in older people. What ganglion cysts are is basically they're a fluid-filled sac, and what occurs is there's basically a small tear in the capsule or the lining of the joint, and then every time you bend your wrist and twist your wrist, that fluid from the joint gets squirted out through that tiny little hole, and it basically creates a water balloon. The reason it got its name as a Bible bump was it used to be that people would literally put their hand on the wrist or on the table and they'd get the biggest, fattest book that they could find, which was typically a Bible, and slam the Bible on the wrist. I'll let you know we don't do that anymore. So as I said, these are typically not something that's bad. It's very common in those two areas. Again, it's something typically associated with some minor trauma. One of the main symptoms that people complain about is either an unsightly bump that they don't like, or there can be pain associated with it. Typically, pain is associated with full flexion, where the bump's either getting squeezed between bones or getting compressed versus the tendons, or full flexion. And so people typically will say getting up out of a chair hurts, doing push-ups, those type activities can ultimately cause pain due to compression on that little sac of fluid. So what we typically talk about is assuming that you have normal symptom or you have common symptoms, or if you can see the bump, then typically it's a fairly easy diagnosis. If you're having pain, again, at the extremes of motion, sometimes an MRI is required to both confirm that you have a ganglion cyst as well as the location of it. So assuming you've been diagnosed with a ganglion cyst, the options are really one of three. One is to ignore it, assuming it's something that you can see. Once it typically reaches the skin surface, it's not something that's typically that painful because the pressure is usually relieved. However, again, some people don't like the way it looks. Typically, I tell people if they're concerned about the way it looks, you're going to exchange a bump for a scar. Alternatively, if it hurts, your options are to either aspirate it, which is try and pop it and drain the fluid, or surgical excision. So with aspiration, things to know about the aspiration: one, it's a pretty big needle. The fluid is pretty thick. It's sort of like hair gel, and so a small needle will not do much with regards to allowing you to aspirate or suck the fluid out. So again, it is a fairly large needle. The other thing is it's typically about a 50% or less chance of actually preventing it from coming back due to the fact that you're not addressing the main problem, which is that little tear in the capsule. One additional thing with aspirations, if it's on the palmar side, you have your radial artery, your radial nerve, and your median nerve in that area. It's some pretty expensive real estate. We typically do not stick fairly large needles in that area just out of concern for injuring those type of structures. So assuming you've got a ganglion, assuming it's painful, and we want to talk about surgical excision, really it's not a big surgery from a standpoint of it takes usually about 10-15 minutes to remove the bump. It sounds counterintuitive, but we actually go down to where the bones are, to that hole in the capsule, and actually make that capsule a little bit larger. In doing that, your body typically comes in, scars in the hole, and again, typically it does not reoccur. Even with surgery, there's approximately a 10 to 15% recurrence rate, and so while they're not something that's terribly bad, they can be a bit of a nuisance in getting rid of. So post-op, assuming we do proceed with surgical intervention, there's really no restrictions afterwards. You get an ACE bandage for 3 days. If it's on the back side, we try and put typically stitches that dissolve. If it's on the underneath palmar side, we typically use non-dissolvable stitches simply because that range of motion can ultimately result in those stitches popping. So we want to use regular non-dissolvable stitches. Either way, at 3 days, the dressing comes off, and really you're able to perform any and all activities that you're comfortable doing. Most people say within a couple weeks they're back doing really almost anything they want. Post-operatively, one other thing, lots of times after surgery when the dressing comes down, there's a fairly large bump in the area where we perform the surgery, either on the back side or the underneath side, and people worry that I missed the bump. Don't worry, we didn't miss the bump. Typically, it's also not the bump coming back, it's just scar tissue or bleeding underneath the skin associated with the surgery. And so that bump will typically go away over the course of a couple weeks to a couple months. Sometimes in the older population, the non-12-year-olds, the ganglion cyst can occur due to arthritis. If you're not 12 and typically have a bump in these areas, the thing we worry about is arthritic changes that are resulting in a ganglion cyst, or the joint fluid being created, or the joint creating more joint fluid than it needs to try and lubricate a worn out joint. In those instances, we can certainly try and take out the bump if it's something that's bothersome or painful, but in most cases it's the arthritis that's causing the pain. Additionally, without addressing the arthritis, which sometimes can be fairly extensive, the ganglions can reoccur, and so that's simply something we need to discuss and understand the potential chance for reoccurrence if it's associated with arthritis. So that about wraps up ganglion cysts. If you have any questions, please feel free to let us know.